future of healthcare has arrived. Artificial intelligence and machine learning are transforming the practice of medicine and improving patient outcomes. This is Smarter Healthcare with AI. Conversations with Dr. Hassan Tetteh as he shares insights into the healthcare of tomorrow and how we can help create it today.
Welcome to Smarter Healthcare with AI. Today I'm joined by Dr. Anthony Mari, the founder and CEO of Docsnap, a healthcare innovation company born from his family's struggle with fragmented medical records during his daughter's chronic illness journey. As a chiropractor, father of 6, and active community volunteer, Dr. Mari combines professional insight and personal experience to revolutionize patient-centered care. His mission is to ensure seamless access to critical medical information for both patients and providers, transforming the healthcare experience for families nationwide. Anthony, welcome to the podcast. It's an honor and a pleasure to visit with you and have the audience learn about your great work.
Hey, thank you so much. And I appreciate your time and willingness to hear the story. So
Yeah. Well, you and I have had the honor and pleasure to meet, some time ago, and we've shared many meetings together. And I've got to learn about your work and your great innovation, but I've also got to learn about your family. And I think there's a really deep connection and a passion that is rooted in what you do. And before I let the audience, hear a little bit about that, I just wanted to personally thank you for the great work that you do. And I will say that, it's never been lost on me how one's passion and sometimes the challenges that we face in life can turn into a great benefit for many people. And I think in this case, what you and your team have put together, born out of a challenge, born out of some frustration and certainly some family struggle, has created, I think, something that is going to benefit many, many people. So I just wanted to personally thank you for that. And of course, since we hail from New York originally, we'll have to excuse our collective accents here, because we start talking our Brooklynese, New York, Long Island accents will start to come out. But it's definitely also an honor to commiserate and to collaborate and to partner with someone from my hometown of New York. So Anthony, why don't you take us to the beginning? Tell us a little bit about Docsnap and tell us what it is. And obviously, this is a podcast about smarter healthcare with AI. We'll talk about that, but I think it will be really good for the audience to really, hear how this all came about, because I think it'll resonate. Your story will certainly resonate with folks.
Docsnap was actually came to market with a group of great individuals, good friends of mine, ones that we're mutually connected with, is Dr. Kevin Dorrance. And back prior to COVID, we really came to to the market as an opportunity to work with value-based care kind of entities, helping them try and aggregate data through their patients to be able to promote better records for assessing risk. COVID then unfortunately got in our way, right? And at that time, I'm a very blessed man. I'm married to my best friend, my wife Jenny. We have 6 beautiful daughters, and along that journey, my number 3 daughter, Molly, who is kind of our figurehead and story behind Docsnap, right before COVID, Molly just wound up coming down with a rare illness called Ehlers-Danlos syndrome. Really was a symptoms of dysautonomia as a result of head trauma from being a high-level soccer player through her youth and all the way through high school. So as a result, when Molly was first exhibiting symptoms, we weren't sure what was going on. We were looking at her as a fact of maybe being a late stage diabetic. So what happened, second game of her senior year on the soccer field, Molly passed out. And it was very uncharacteristic, obviously. We were really worried about what that could have caused or what caused it. And as a result, we started evaluating. We went back to the pediatrician to have some evaluation. We went from there to pediatric oncology, endocrinology. And as a result, we were thinking that we have some diabetes in the family. Maybe Molly was exhibiting late stage juvenile diabetes, and it turns out nothing. From there, GI symptoms, cardiac symptoms were getting worse and worse. Then we started visiting, again, specialists that we can find in every health system here in Atlanta. And the biggest problem that we found in doing that is there was a massive disconnect through the medical records. You get to one healthcare provider, you explain the story, they formulate a record, and then you go to the next and it's the same story over and over. And the common theme there was, please tell us everything all over again. And you're like, well, why? You're on Epic or you're on Cerner, and interoperability exists. How do you guys not have all of the information? And it just turns out that, a symptom of healthcare today where it's time related to physicians in their current roles in the health systems, the overload of patient base, or sometimes it's even a lack of resources in their clinics to be able to do thorough pre-screening of a patient by leveraging interoperability to get their medical records. So as a result, we wound up unfortunately experiencing things that you never thought would happen. Medical errors were due to medication mismanagement as a result of not seeing what one provider prescribed versus the next. Surgical error, and let me see what else. Reproducing multiple CT scans and everything you hear of as a nightmare on the side of an active patient. One of the things when we were in the hospital with Molly, I found very telling, which, we're giving an example. We're at Will Star Hospital here in Atlanta or Marietta, Georgia, and Molly's in the hospital. And obviously, I don't really broadcast to anybody that I have a clinical background. So when the physicians come in and they start what I call doing the interrogation. Well, it's everything about you, Molly. And I start filling in the blanks, right? Because I know how to speak. And then it, becomes aware that, hey, you have a background. Yes. Yeah, I've practiced for 18 years. So, they, ask about their opportunity to leverage their Cerner system on the wall. I'm like, or Epic system on the wall? Why aren't you using the EHR to pull Molly's records? And the same story, right? It just, not enough time. The system doesn't really promote us to do that, and at the point of care. And so, then I asked, so then you're just relying on us to fill in all the blanks. And roundaboutly tried to give me a good answer, the hospitalist. But then Molly chimed in and asked him, she goes, what do you do for people that don't have a doctor dad?
Right.
To fill in all the blanks. And unfortunately, the physician didn't have an answer except a smile and a grin. And he's, I get it, but this is kind of what we're faced with. So out of this journey, Docsnap was born. So Docsnap has come to the market as the first healthcare utility for consumers or patients to leverage to be their best advocate at the point of care. Today, problems in healthcare, as we know, it's the third leading cause of death. It's the leading cause of bankruptcy in the United States. And a lot of it has to do with just the disconnect of the medical records at the point of care where they're needed. Again, duplicate testing, medical errors, all things that can be avoided if the records would be there. So that's what we set out to do. We set out a way to pull together a solution that benefits individuals, not necessarily healthcare providers, but indirectly it does. So we collectively put our heads together and looked at mechanisms that we could leverage that keeps us independent and outside of the regulatory environment for healthcare. The only way that we could do that is to empower individuals to leverage their HIPAA rights to be able to request, consume, and then share their medical records when they need it and when they want it. To help one another, to help each other as a family. So we're a family-based concept. My wife and I share a mirror image of our application so that we can, no matter where we are or together or apart, she's with some of the children, I'm with some of the children, something happens, we both are informed and have the ability to prevent things and errors from taking place. The neat part about it also is we're able to expand, right? My mom lives in New York. My father is deceased. My sisters don't have a clinical background, live near her. So I was able to connect with my mom and get access to her medical records. So in case I'm called to be an advocate on her behalf, I have access to be able to, to do that eloquently and and again, be an advocate in our behalf.
Right. So, so folks are probably listening to this and they're saying, well, I have, my Healthy Vet, or I have my Epic portal, or I have my MHS Genesis portal. And they're probably saying, well, I can get my medical record, sort of. But, I'm of course leading this question, and obviously I know how unique and how different your Docsnap platform is. But yeah, for certainly folks that are listening in and thinking, well, I think I have access to my record, or no, I pulled up my Epic chart right here. What is the distinct difference with Docsnap that differentiates this platform and the application from exactly what I'm describing, where many in the audience may say, oh, I think I already have that.
The biggest difference there is, and I appreciate the question because I get asked this one all the time, that the biggest difference is that the Epic system where you seek care only sees the care that is delivered in that system.
Exactly right. Yeah.
Right. So the disconnect and the idea that interoperability works, and unfortunately, Epic everywhere isn't necessarily Epic everywhere. It's not even Epic everywhere. Sometimes in the same exact hospital. So what happened where Docsnap comes to play is we help you to aggregate your records from all the different points of care, and then we consolidate it into a single view for you to be able to read, understand, and then to be able to share with your care teams. The key is to allow you to empower the people providing care, right? Take out the guesswork, take out the ambiguity in trying to figure out what's going on, right? Empower your care team to deliver you and your family the highest quality care possible. Independent patient portals sometimes are also not manageable. In Molly's circumstance, in Molly's case, with care and 7 health systems here in Atlanta, and then leaving Atlanta because of the disconnect in the medical records to go to Mayo Clinic in Jacksonville, Florida, that, it's just unattainable for people to manage that many patient portals. And you're only going to have the records that are available to you from that point.
So I just want to share with the audience why Docsnap is very unique. So I have Docsnap here. Probably can't see it on the phone, but it's on my app here, and I have it. Maybe that's a bit better. And we talked about how to get the application, and you go through some verification, of course, and some identity check to make sure that you are who you say you are, and then once I log into the platform, it begins to pull my record. And again, people may be saying, well, it does that right now with Epic. And you're saying, to your point, that only does that for Epic. But if you were to be seen, let's say, in a hospital in Texas while you were there on vacation, and you live in Arizona, and you go, to New York to visit some family, and then you get hospitalized, your record is not going to necessarily be accessible to you. And what Docsnap did, actually, as I did this, is it pulled all my health records from every place that I've been seen at. And then what it really did, which was really functionally helpful as well as useful in terms of a utility, is it starts to categorize things like my allergies, my encounters, my functional status, immunizations, medical equipment, like all of these things, plan of treatment. And the platform has sort of created a user-friendly interface that now I can not only understand and digest what has been sort of accumulated in terms of medical record for me, but I could share aspects of that with whoever needs to know it at the time when I'm, most in need of that information. And so again, I'm bringing that background up because I really want to drill down to the uniqueness of Docsnap. And what you have done is you've created a situation where the individual becomes the health information exchange. So just explain that a little bit to the audience, and how did that even come about as far as an innovation and something that intuitively seems so simple and appropriate, but yet pretty elusive for the far majority of what happens today.
Well, that's an interesting journey. I had several opportunities early on to learn about different health IT infrastructure capabilities. I learned a lot about the use of direct messaging and started really getting into the thought of interoperability and how to solve for it. And it really came to a common denominator, right? Unfortunately, the federal regulatory requirements and HIPAA become a barrier to everybody in healthcare. That is on, like I said, the regulatory side, right? It's a fear, it's a lack of identity in individuals. It's the fact that they all have their own closed loop system that, in essence, it's not in their best interest to share, right? We heard stories about, why do I want to give up my medical records? I don't want my patients leaving my health system. So the only way, you and I are the source of truth, right? If we weren't, they wouldn't be asking us at the point of care to fill in all the blanks, right? So with us being the source of truth, it became, what's the best way to do that? So I started doing some research into the law, and HIPAA really clearly states that if you and I have the technical functionality in our own possession, and the health systems on the other end have received federal assistance or subsidies for implementing an electronic medical record into their system or into their environment, then they're obligated to give you your medical record in the method that you request at no charge. So then we basically looked at a mechanism to do that. How do we do that? How do we follow the law? Visited plenty of attorneys to get opinions. I was blessed enough to get an audience with the Office of the National Coordinator when physician Dr. Don Rucker was the ONC himself. I got to meet him and his counterpart, or his assistant ONC deputy, and I think it was not a senator, but a Congressman Kennedy out of Louisiana, and explained to them what we were doing. And they thought it was fascinating, and it was the only way that they thought interoperability would really be solved is through the individual. He made it pretty clear to me. You know what the ONC does, right? We make all the rules, right? You know what we did last year? We made rules. Now we're going to do this year. We make more rules. The rules we made last year, and that seems to be a steady pace of what's taken place. So the idea was, how do we empower again the individual? So it started looking at building common healthcare technology, but instead of putting it under doctors and health systems, we put it under you and me and our family.
The individual, yeah.
Right. So the idea there is we are a well-certified modular electronic medical record with direct messaging in the hand of an individual that allows you to be that source of truth, to be the aggregate source, because they can't just tell you no, unfortunately, which is in our best interest, right? They can't tell us no. So with you being able to aggregate your medical records, as everybody says, when they're in my possession, I can put them on a billboard, right? I can do whatever I want with them. I could share them. I could burn them. I could do whatever. They're on mine. So, when you look at today, how many people own their medical records in the United States? Pretty much nobody, right? They live inside of a patient portal owned by somebody else, right? A system failure takes place. They can't access your record. Then what happens? Who suffers in that scenario but you and I?
Right, individual.
Yeah, the individual, right? And when you look at those, like as stats I said earlier, the third leading cause of death, leading cause of bankruptcy in the U.S., a lot of that has to do is a result of the lack of the record being available. So we put together extensive technology, safe and secure, using, like I said, things that healthcare uses today, in an attempt to now put it in your hand and make you the sole source of truth for advocacy, right? It's really about you and your family. That's what matters most. I saw what happened to Mali to be unacceptable. And knowing that with, over 180 million people in the United States with complicated health histories, the stats I said are you can understand why. We had the opportunity at CARE to mitigate expenses and mitigate duplicate testing. Physicians are walking in, I can't provide treatment today until I do a CT scan. Well, I had one, Molly had one like a month and a half ago.
Yeah.
But I just don't have access. So if you want treatment today, we have to redo the CT scan. So I open up Molly's Docsnap account and put a record in front of them with the results, and they go, well, first of all, how did you get this? This is a CTD. This is a real medical record. And I'm like, yeah, it's a real medical record. And So they read the results and they're like, okay, we don't need to do the test. Let's move on. We've had multiple opportunities to do that at the point of care, which really, we had one phenomenal story with our journey to Mayo Clinic in Jacksonville. And this is, I think, where, Molly at the point had been really compromised. And as a result of being ill and taken out of college and having to be at home and on feeding supplement, not being able to walk, being confined to a wheelchair, to having seizure-like activity, it was painstaking to watch. And then when we decided to leave Atlanta because of the disconnect in all the medical records and the overprescribing and problem list that was growing out of control for a girl that really had no disease, that we decided to connect ourselves in an integrated system in Mayo Clinic. Wonderful care down in Jacksonville. And, but it was a long journey, 7-hour car ride in each way, 3 or 4 days in Jacksonville, had tests, and then you go home and then you come back for more tests and results. So at this point, Molly's GI system was really causing a tremendous amount of discomfort and pain and problems due to the dysautonomia. And we knew that GI doc was the last person in the food chain we were going to see at Mayo. And the week before we went, I knew it would take at least 60 days to complete all of the GI testing that would be required. I'm very blessed to have some great physician friends here in Atlanta, and I called a friend of mine, Dr. Agnes Hahn, and we put Molly in the hospital in Northside the week before we had to go to Jacksonville to see the GI doc, and we ran every test there was. We got out of Northside Hospital on a Friday. We pulled all of our records. We were in Jacksonville on Tuesday. And we got to meet the intake nurse. Triage came in and we described everything we had done in Atlanta last week. Finally, the physician comes in. We meet him for the first time. He sits down, and charming guy. And he sits down and he explains, hey, Molly, I've had the opportunity to review all of my partners here at Mayo, their medical information and all the tests they've done. And I think I have an understanding of what's going on. And he said, and I also learned that you had all of the tests that I would need to see done last week up in Atlanta at Northside Hospital. Unfortunately, my electronic medical record doesn't speak to theirs. So, and here at this point, Molly's anxiety and depression was very high and cumbersome and dangerous, to be honest with you. And so, but this one journey down in Mayo, she's kind of excited. She's ready for someone to tell her how we can help her stomach issue and this pain that she's having. And the minute so she's sitting up in her chair, she's engaged with the physician, and he makes that statement, I can't do anything for you today until maybe I can get you on a calendar and do some stat tests, or maybe we can reach out to Northside and see if they can fax us some information. And I just watched her start sinking in her chair. And I said, time out, I've got all of her medical records right here. And I looked at me, looking for me to give him a stack of paper or some. And I just opened my iPad and I put it in front of him. And as you know, like you said, the way we organize the data is completely searchable by category. So we put it in front of him, and he looked at me, same question. This is a CCD. Like, how did you get this? Yeah, I'm like, yeah, that's kind of what we do. So, but you can search it very quickly. Pick your category. Here is everything you're going to need to see. And about 6-7 minutes later, he turns around and he closes my iPad and he says, Molly, great news. First of all, thank you, Dad, because I've never had the opportunity to see clinical data like this. So this is really amazing. But the best part about it is I know exactly what's going on and know exactly how I can help you today. And that was the really big turning point in Molly's journey. Started giving her the enthusiasm and the tools now to start interacting, with her health directly, with a sense that someone cared, someone knew what to do, and they could provide help versus just, let's see what the next guy tells me, right? So it really was a pivotal point in Docsnap's journey for me, for my family, for Molly especially. But it let us know that we really had something that we can deliver to people with all types of chronic issues or healthiest people in the world to be, again, their best advocate at the point of care.
Yeah. your journey with your family certainly has validated the utility of Docsnap. And I can tell you from a provider standpoint, I've been in scenarios and situations where, as a surgeon, people have come into the ER. We've seen consultations on the floor with people that have, pretty much a surgical emergency or something that is surgically urgent. But we've had incomplete information, and we may be delaying our care or our therapy because we have to get more testing. And I can tell you that before Docsnap existed, I would berate some of my colleagues, or I'd have a medical student or resident search down or hunt down, a test or result, a CAT scan from another hospital, making phone calls, getting, faxes, trying to send them by secure messaging or email. And it's made a big difference in terms of, the decision process, the algorithm, in terms of what we're going to do from a therapeutic standpoint. But not everyone's going to have that due diligence. Not everyone's going to have the opportunity to be able to do that, or the resources. And then, of course, as I mentioned, turn it around on the family side. In your journey, like you said, there are millions of people who just simply don't have the sophistication, the resources, or a platform like Docsnap that can bring in aggregate all of the information that's necessary to help at the time and the point of care, the providers and the team that's taking care of the individual make the right decision because they have incomplete information. And I can't imagine, how much of a difference it would make if this was a universally accessible resource for everyone. And it's unfortunate. And I'm sure you've said this as well. It's an unfortunate and yet incredible blessing that you have had this experience, because out of it was born Docsnap, and a resource that can help a number of people and hopefully millions of individuals. So, sort of shifting gears a little bit, that's sort of the origin story of Docsnap. And then where are we heading now in the future of this platform and this utility, this great resource? And what's your vision for, getting Docsnap into the hands of others so that, you can avoid a lot of the challenges that you had with Molly and your family, and sort of alleviate some of the pain and suffering we've all felt as providers when we're like, I need more information. Where's your record? And the frustration that comes from the patients when they say, well, don't you have all of that? I just told the last guy all of this stuff, and you're repeating all this information. So sort of thinking about this next chapter of Docsnap, the pandemic is sort of a little bit behind us. It's still around, but certainly not in the same intensity as it was before. And now you've had, a series of validating moments, not only with you personally and your family, but, seeing it sort of in practice. And I've had the benefit as well as many others to sort of see the power and the potential. So what's next for Docsnap?
Well, what's next for Docsnap now is, we're in that planning phase right now for what we would call a resource market. One of the biggest problems I saw also, in addition to as a result of the lack of the medical record, is that people are left on their own, right? There's no such thing as an order fairy or a post-diagnosis genie that follows you around to inform you what needs to take place next. And, like I said, the biggest thing I found as a result of that with Molly was the fact that, the time to resources really matters. Really, really matters. There are statistical data out there that post-diagnosis, it takes health systems, your insurer that's responsible for care coordination or care journey events and support of you post an event. Usually takes somewhere around 6 to 9 months before they get to you as a result of a downstream push through the insurance companies with your data. So in that time frame, people suffer and they become riddled with anxiety and depression. And again, they went up chasing Dr. Google and spending all their own money. And I think that's totally unacceptable. People ask me, really, why did I do this? Again, out of Molly's story, born a passion to try to make sure people can get the resources they need in a timely fashion. I think that with the use of AI, which we're looking at extensively right now, how when we have a comprehensive medical record, or I call the most vital medical records on individuals, the AI could come in and help promote resource journeys or bring in the right resources or educate them to the point of, informing them they're just not alone, right? That's a real terrible feeling to be alone, right? I've had the blessing to be on a cancer charity for many years, talk to people with cancer and understanding what, their biggest plights were when they were diagnosed. It's not necessarily fear of death or the medications, going bald, being sick forever. The biggest result was I just didn't know what to do. I didn't know what to do next, right? And that's a horrible feeling. So the resource market is, the idea here is you should be able to get to the resources you need for care when you need them, right? You shouldn't have to go hunting for them. You shouldn't be waiting for someone to come and spoon feed you on how to do it. People are proactive and they want to be able to be proactive. So we're looking at the use of AI to be able to look into the medical record and, again, promote access through looking into your payers and what resources are available to you, looking at your social determinants of health, where you live and your circumstances and how can we support you. It's kind of like an Docsnap approach. Looking at voice bots and things to make the utilization of the medical record not only a tool when you need it at the point of care, but a resource. Leverage the data using AI, tapping into third-party providers that have resources that can benefit you. And then really just trying to find a way to empower people and close that time gap. 6 to 9 months is acceptable, right? With the data in the form that we provide, you can have answers to your issues in days versus months. So resources, from everything from virtual care to which we provide today, or one of the biggest problems we found with Molly and her with the shortage of primary care in the United States, with her being confined to a couch or a wheelchair, or seizure-like activity, she got sick with strep throat from one of her sisters coming home from school. What do? And you call primary care, you can't get in a visit because they're overwhelmed because it's the middle of winter and everybody's sick. So the next statement was, well, take her to urgent care. I'm like, I can't take Molly to urgent care. She has one seizure-like movement. They're going to call an ambulance and take us to an emergency room. So they're like, okay, go to emergency room then. So I'm like, yeah, okay, so for strep throat, you want me to take her to an emergency room? They're like, well, if you care today, that's what you should do. So we did that, and instead of it being a 3-hour or 4-hour event at an emergency room for a strep throat and a few $100, it wound up being an 18-hour event and a $20,000 episode with her just because they didn't know how to handle her in her current state. Well, that's just unacceptable. So one of my passions were to get people access to care. We had the opportunity to try telemedicine. It was very unfruitful because someone with complicated health history, which I completely understand, the physician on the other end of the phone saying, I appreciate you. I don't know you that well. And for safety in mind, I think it's better for you to go seek treatment in person. So what we've done is we've contracted with a national telemedicine provider in all 50 states to be able to provide primary care, urgent care, as well as behavioral health care. And we integrated your medical records now in a telemedicine solution. In the event that hopefully if you need after hours or virtual care on demand, if you're traveling, if it's late at night, a supplement, that the provider now hopefully will be able to see your medical record and hopefully be able to provide treatment if necessary. Right? I don't have a fear anymore. I can understand you. I can see everything about you.
Right. With the access to the information that, in most circumstances is often lacking. Thus, every episode and encounter with the provider for most people is another rerun of Sherlock Holmes. So
yes. Well, even on virtual, right? And then you tell the whole story, and it's still, I don't really know you well enough. So resources, and again, leveraging AI to be a supportive mechanism is a real big deal for us. So we're in that formation right now of aggregating the appropriate resources in step to be able to, again, help people get to the care resources they need when they need them.
Yeah. So again, thinking about the future, certainly you mentioning AI, what have been some of the ways that you guys have navigated, certainly the regulatory privacy trust issue around Docsnap, right? Because, what you're providing an individual is an incredible resource, right? The ability to have all of the documented healthcare record of their existence in their own hands, in their possession, which can be incredibly powerful, right? You said this empowerment of like, you know, the individual. So not only can they see all of this stuff, but they can also share it with their discretion to who they want to share it with when necessary. But again, you know, you talked about like how it was that you came to this point. How did you navigate the regulatory and how do you continue to sort of make sure that the privacy issues and some of the trust issues are sort of not only inherently built into the platform as it exists today, but moving into the future are only going to increase in terms of reliability, trust, and compliance with the you know, the regulatory environment that's so characteristic of healthcare?
You know, that's a very good question. So it's kind of a loaded question to some for some reason, because, you know, depending on the audience, they like my answers or they don't like my answers. Okay.
Right.
All of it is that the reality of it is you are the only node on the healthcare circuit that they can't say no to when you ask and request your medical records.
Yeah. And I want you to repeat that because that's really the essence of what I wanted to come out of the question.
Yeah. You are the only node that they can't say no to.
Right.
And the government is taking stances now on data, what they call information blocking. And it's not just when you seek information in person. If you go to the health system, they have 30 days to give you your data and they charge you for it. Again, according to HIPAA, if you have a tool like Docsnap, they have a 3-day window and they can't charge you for it. Right. So it comes down to an identity issue. The big problem with 21st Century Cures Act, when it first presented, we had a lot of advent of different applications have come to the market to try to do what Docsnap is doing. They position themselves in the form of being an extension of a healthcare solution, which puts you right in that regulatory envelope. So our goal is to stay out of that regulatory envelope, but to play by the rules all at the same time so that the people on the other end in healthcare can understand that we've taken the appropriate measures to make sure that the individual is who they say they are. And healthcare today, third-party apps, especially if you want to leverage some of the national connectivity and what's called the exchanges, eHealth Exchange, Care Quality, Commonwealth, they're easy for them to say, we don't support third-party applications because how do I prove that they have a relationship with the end user? How do we know it's not a nefarious actor asking for Anthony Mari's medical records? And then most of those applications in their terms and conditions state clearly that they're looking to help you get your records so that they can turn around and sell them for profit.
Sell your data, right?
Exactly. The same data. So Docsnap doesn't do any of that. If you look at terms and conditions, it's not on chalk. It's to support individuals. So, you know, when we came to market, it was, you know, we want to build and, like you say, stay what everybody would see as perceived compliance. Right. So we started with using, you know, the same identity credentials that are required in healthcare today with level of authentication 3. We use secure direct messaging. So we're really one of the first groups in the U.S. that will be able to supply secure direct messaging capability now on a national scale to individuals, not health systems. First, a common friend of ours told me when he learned what we were trying to do several years ago that there's no way I could do this because you can't scale direct messaging to consumers. It's too expensive. And unfortunately, if you ask my wife, that's probably the worst thing to tell me is that something I just can't do. So I made it, again, part of my mission. And we've done it. We found a way to use secure messaging, which is, again, we know is provided just strictly in the healthcare spectrum. To providers and health systems to securely change dates, you know, message about patients and trade data. But it's used as you can't get a direct message unless or address until you're credentialed, prove your identity. So that's the best way we've done it is to make sure as a patient uses our utility, the request goes out on direct messaging from their direct email that proves their identity. And then is in compliance with what HIPAA says for an individual requirement to be able to access their data on the exchanges. So we tried to do everything according to process that would, give comfort to the care teams. People ask, why did you formulate the data the way you've done? It's more clinically centric than maybe consumer friendly. And I said, the reason we did that is because you should be in concert with your care team. Kevin and I and other people, the doctors on our team, it all became around how do we not only empower the individual, but how do we empower our care team? So to make sure that when they see the data, they realize that the credential or the provenance it carries is an actual medical record that's never been tampered by an individual, that they can trust at the point of care to help you when you need it. So it just became about making sure we identified a way to prove the record's origin, and that the individual who is requesting the data and sharing the data is the person who that record belongs to. It was a journey, but it was a technical feat. Technically, I'll say to kind of pull this off, because it wasn't an easy thing to do.
Yeah, but you've achieved it, and I can say, with complete confidence that when I went through the verification process, it was, very, comforting to know that, oh yeah, well, no one's going to have all of these information, all these attributes that, are about me, unique to me, to be able to request this over this secure channel and then get it. And then now, have my biometrics incorporated into the authentication process when I log in. So it's great, and it probably was another level above even my banking situation that I've had to deal with. So from my standpoint, I was like, oh, this is good. This is great. This is excellent. And then again, to have that empowerment of having the data as a on my fingertips, at my fingertips resource that I could share and access when needed is very comforting to know that ability exists. We talked a lot about how Docsnap came to be, and sort of a little bit about where it's going. What has been one of the greatest sort of satisfactions you've had as an individual that's sort of pioneered this innovation right now? Like what you certainly have talked a lot about the challenges you've had and the frustrations, but I guess what's brought you some satisfaction and a level of joy, if to go so far, of where you've seen the platform, sort of come to at this point?
We've had some small victories. Well, I will say that, we're pretty impactful with the use of the app, not only in Molly's journey to be able to, prevent duplicate testing and to be able to help share, the record at the point where, again, you can avoid ridiculous costs. But I did have a beta user of ours who husband changed jobs, and she was behavioral health issues personally. And when the husband changed jobs, benefits changed, and then she needed a refill on her medication and couldn't get an appointment with a psychiatrist for like 60 days. She didn't know what to do. Put in a call to Docsnap, and I said, hey, look, go on to our telemedicine provider, choose behavioral health. They'll be able to see all of your medical records and be able to hopefully provide you the treatment that you need. And then I got a message from her 2 days later that said that the experience was truly life-changing for her, that she was able to get on with the therapist very quickly, saw the records, explained the story. The therapist connected her with a psychiatrist a couple hours later. The psychiatrist was able to see her medical records, have a fruitful discussion with her. And about 3 hours later, her medicine was delivered to the local Walgreens in her neighborhood, and called me to tell me that, instead of 2 months in suffering, I got it in the same day that I started a journey using Docsnap. So I tell all my friends, those are the victories, right? Those are the small things that matter, right? Because it's not about me. It's about how do we help others, right? So if this improved, this woman was really panicking that I'm not going to have my medicine. Like, what am I going to do? And all of a sudden we were able to help her get what she needed. And what gave the physician comfort to prescribe that kind of medication virtually was the fact that he saw her records. And that's what he was excited about. I was like, wow, this is just great. It was his first experience on the other side of the platform, seeing what we were able to deliver to him to make, get him to empower him to make and support the individual and the patient on the other end of the phone. That's one. Getting in the App Store was another big milestone. Sounds simple, but it's not simple at all. Get through all that hard work. Thank God for my wonderful team. Been very blessed, and great support from my wife and kids. It's been a journey. The small victories are that. It's not about me. I don't really need any accolades. I just want to be able to help as many people as we can. Under the premise of give, love, and serve, right? That's what God wants to do, and that's kind of my mission and what drives me.
Yeah. Well done from that standpoint, I will say, having experienced it and then now having had the opportunity and great honor to get to know about you and your work and the great teamwork that you guys have, sort of pioneered to make this reality occur. Thinking about, the arc of time, you and I talked about how our practices are very similar in terms of how we came through the evolution of what we've now witnessed over the last few decades of how healthcare has changed. I think you and I are both of the opinion that healthcare moving on into the future is going to change dramatically more, by circumstance, because of technology, and because I think of the collective frustration in the system of inadequacy and, a disappointment for so many. What gives you hope in terms of the younger generation of folks, not only providers, but also the patients, right? Because, I think you and I are at an age where, there's perhaps a little bit less time ahead of us than there is behind us.
We're on the down slope of the sine curve.
Right, well, to some extent, I think there are great years ahead, no doubt. But nonetheless, there is, and you have, and I guess I'm getting at the fact that you have 6 daughters, I have 2 children, and I see, a difference, right? Every generation sees a difference in the younger generation in terms of their acceptability and their, sort of collective embrace of things that, seemed foreign to us, or seem foreign to us. But, I just want to get your perspective on that, because I imagine that there have been some, folks in your children's generation and your daughter, in fact, as well, that have sort of engaged with the platform like Docsnap and all these other technologies. What do you see, as a difference in terms of how they interact with these things and in terms of, or in contrast to how we we engage with these things in the past?
I think we're meeting the next generation where they want to be, right? And it's a lot of it has to do with convenience in life, with everything that I watch my kids do now with technology. And unfortunately, as much as the healthcare in the United States wants to elevate itself, healthcare today is so riddled and burdened with regulatory oversight that I don't, again, and the rules that shift almost on a yearly basis to try to make improvements. I just came from a conference about a week ago. And as much as the old adage, it's the same old with a slightly different flavor of the year. I'll call it, not of the month. But it all comes back to the same common denominator that, interoperability is an issue, and it will continue to be an issue. I see the only way interoperability gets solved is through you and I. We are the source of truth. So today it becomes about meeting the individual where they live and how they perceive, how they want to run their life. And we looked at interviewed moms, right? They make up majority of the decisions in healthcare. Kids today, look at my older daughters. I'm a grandfather of 2 beautiful girls and a grandson coming in a very short period of time. And you watch how my daughter manages her children new, and it's all about, information. How do I have it at tip of my hands, right? The idea that you're getting on phones to make appointments, and then go and sit in waiting rooms, and then they give you a stack of paper on the way out the door of your current visit, just is mind blowing. They're like, well, why can't I do everything right here on my device, right here on my telephone? And I think it's a matter of convenience and meeting people where they live, right? They want to be presented with resources, not search for resources. And I think today, with the advent of AI and with a fairly comprehensive view of a medical record, you have a better chance of really making improvements in people. I think Don Rucker actually said it best back in his 2020 or 2021 yearly address. There was this big discussion about AI in healthcare. And he made it pretty clear. He's like, unfortunately, the way medical records are siloed, we have to be really cautious in healthcare because AI could as much as hurt you as help you. Right?
Right. So with inadequate information.
Inadequate information. So before we get ourselves too in depth with AI in healthcare, we've got to find a way to break down this interoperability barrier and get more of a comprehensive record set so that the AI that we run, we can know and trust versus just shotgunning it because it's the new flavor of the year with AI. And I think we're in that. I think we're facing that today. And, again, the younger generation uses AI in everything they do, from Chat GTP and Ask Siri and Google to, information when they want it, when they need it. So I think meeting them in that capacity, empowering them to be in charge of their records, right? Why ask me? Here, everything I need. Let me send it to you, right? So I can be ensured that I didn't forget to tell you something that compromises my personal health. And so I think it's about empowerment. I think it's about making sure the solution and the application, as we keep striving to make it better every day, becomes more and more user friendly, right? Really empowering people, especially the younger generation, because that's what they're going to expect. And if you can't deliver that, they're not going to play, right? And their perception of healthcare is dangerous in a lot of them, right? Because what do you mean my records don't travel? It doesn't make sense to my children, right? I mean, they're smart people. And they're like, this just doesn't make any sense. So, our goal is, again, and I think for that, to answer your question long-windedly, is I think you have to meet people where they live today, right? Their device is their center, their center of their universe almost, unfortunately, right? Yeah, but for good and bad, right? It has its pros and cons in all directions. But I think when it comes to healthcare, we shouldn't make people wait. People deserve not to suffer. The longer that time gap goes from days to weeks to months, people suffer. They get worse. They expend their money, and it's just not. It's not acceptable in today's technology day and age. And I think that's where we can potentially set a foundation for shifting the way healthcare is delivered by empowering individuals to be that source of truth and get access to the resources and, not be subservient to the healthcare system, but to be, help to drive success in the healthcare system.
Absolutely. Well, I have to say, a huge thank you, not only for, what you've done and what you've created, but you've made a big impact. I think, just anyone listening to this, I can't help but think they have to be blown away by the relative, elegantly simple solution that you've created, but yet, was born out of a necessity to navigate a very challenging situation for you and your family. And ideally come out with an outcome that hopefully not only benefits your family and Molly, of course, but a great number of other people, many people, because I know that this is going to make a big difference on people's lives and impact their health in a positive way. Because to have your health record here accessible is what everybody says they want. But it's not something that's very easy to obtain, as anyone that's navigated the healthcare system knows all too well. And so I definitely applaud your team for what they've done. I think that it's an exciting time ahead of us to think about the application of AI and certainly the application of AI on a platform like Docsnap that has the ground truth for that individual. And I think that's really what we have to move toward. And you mentioned, of course, meeting people where they are. I think that's absolutely paramount in the future. Just on one last note as we close here, I'm sure there are probably people listening because it's a Forbes Books podcast and Smarter Healthcare with AI. I'm sure there are a few entrepreneurs and innovators that are probably listening in. What can you share with them as maybe a parting sentence or a pearl of wisdom in your journey for someone who has a great idea that wants to bring it to reality? I know that could be a long-winded answer, but any pearl of wisdom that you'd like to share with individuals that are, perhaps embarking on their journey of creative innovation?
Yeah, that's a great question. I really think it's persistence, to be honest with you. I think it becomes, if you have a mission, you have to be committed. And yet kind of like all in, and if you're really looking to be successful or to put your best foot forward, you have to be committed. Commitment is the big deal. You can't let capital, you can't let technology and things stand in your way. You have to find a way to adapt and overcome. Some of it is just by maybe keeping the faith, right? And I will say to the entrepreneur out there, the journey is not for the faint of heart, right?
Indeed.
And with that, stick-to-itiveness, confidence in yourself. Don't let people, the naysayers, take over, right? Don't let them get in your ear and tell you that you can't do. You can achieve, right? I tell my children, there's no such thing as trying. You either do or you don't do, right? So be a doer. Our first website, actually, that's what we called our team. Just the doers, so the good deeds, right? That's our goal, right? It's not about us. It's about you. So to deliver that, you have to put, again, everything, you have to be confident in yourself, be strong. And again, faith, and again, stick-to-itiveness is a real big deal.
Yeah, well, that's great. Well, wonderful words of wisdom. Thank you so much again, Anthony, for your time and for visiting with us and for sharing your story, and for all the great work that you are doing now and all the great work that's going to come out of Docsnap in the days to come in the future.
Hey, can I add one last thing? And a lot of people ask me this after hearing the story. I'm very blessed to say my Molly is doing wonderful.
Yeah. Oh, yeah. I know that. That's right. So let me make sure that the audience gets to appreciate that. Very happy ending for sure. Thank you so much for sharing.
Yeah, she's doing terrific. She's part of the Docsnap team. Big thanks for you today for listening to the story. You've heard it several times. But I can't thank you enough for giving us this platform and opportunity to share the story, and very, very, very much thankful.
Yeah. Well, thank you, Anthony, and thanks to Doc. And I wish you all the best and good things. And we have you come back a little bit and hear some more of the great news of Docsnap. All right. Well, that'll end our conversation for today. Thanks so much.
Same here. Thanks so much.
Take care.
This has been Smarter Healthcare with AI. If you'd like to find out how to bridge the gap between medical experts and tech innovators and discover how AI can make us healthier and more human, go to Tetteh.com. Smarter Healthcare with AI with Dr. Hassan Tetteh is a production of Forbes Books.